And Dr. B, which boards certify doctors to do rhinoplasty surgery?
Well, while there are a lot of boards that certify doctors to do different kinds of cosmetic surgery, rhinoplasty is really either in the hands of the ear, nose, and throat doctor, that's the otorhinolaryngologist, and their associated cosmetic board, which would be the American Board of Facial Plastic Surgery, or it can be performed by the general plastic surgeons or the American Board of Plastic Surgery. The ear, nose, and throat related facial plastic surgeons are generally experienced at working at both inside the nose and outside of the nose, whereas the general surgery or the general plastic surgeons mostly are focused on working only on the outside of the nose, which may give them some disadvantage since the inside and the outside are often related in the nose.
Dr. B, how would you advise individuals to save money on their nose surgery?
The most important thing with rhinoplasty surgery and nose surgery is to find out whether your insurance would apply, because many of the deformities and problems with the nose are part of a birth defect, which should be covered by your insurance. Even though this was so many years ago when you were born, if your nose has grown in some unusual pattern, state law in California requires insurance companies to cover it if there's a true birth deformity, which can be severe undergrowth of the nose. If you've been injured and you have a crooked nose and you have an internal breathing problem, your insurance company should be picking up those charges too. If they were a result of an injury, again, they're required to do that. And you may check on your policy to find out whether just because the injury was long before you signed up for the policy, whether it isn't still covered, for instance. Some people need financing, and if you do need financing, you should again make sure that your doctor offers different financing plans and doesn't automatically stick you into a plan where the rates and the interest rates are not favorable to you. You want to make sure that you get in, that your doctor has explored, or his office has explored, different financing programs to find the one that's best suited to you. There may be some portion of your procedure that is functional and covered by insurance, and some portion that's considered cosmetic, at which point you may have some co-payment. And again, you may check with your doctor, and if you don't think that they're giving you a fair estimate, some other doctor may give you a fair estimate of what portion is considered cosmetic and what portion is covered by your insurance company.
Dr. B, how would an individual choose a doctor for rhinoplasty?
Experience is probably the most important thing you need to look for in your doctor if you're going to have rhinoplasty surgery. Amongst plastic surgeons, rhinoplasty is called the thinking man's operation. And that's the doctor doing the thinking, not the patient. And that's because it is perhaps one of the most complicated parts of plastic surgery, because there are so many little parts to the nose, within the tip and the bridge and the middle third and the base, and all these different components need to come together. And so besides paper credentials, that is, your doctor may be a board-certified plastic surgeon or a board-certified ear, nose, and throat surgeon or a board-certified cosmetic surgeon. Within those paper credentials, they may not have had very much appropriate experience, particularly for your problems, and particularly if you're having breathing problems or whatever problems associated with your surgery, or you want to be careful that you don't develop a breathing problem, or you have a cosmetic surgery performed and then you have a breathing problem and that doctor is not comfortable fixing that. So definitely you want to find someone who has skills both inside and outside of the nose and has a good deal of experience and can give you the kind of full management of your nasal problems that you should have.
And what are some of the goals of rhinoplasty surgery?
Well, the main thing with rhinoplasty surgery is, again, to get the nose in balance. And of course, we have this platonic ideal of what a nose should look like. And it's rare to get that perfect nose. And we could look through the magazines and you won't find one that probably truly matches that platonic ideal. And even if you found a picture, it would just be shot at some funny angle to give you that one picture in 500 where the nose did come out to be perfect. But we want to make sure the person has good breathing. We want to achieve symmetry of the nose. We want to eventually have a smooth, straight bridge and a fairly small tip. And generally the nostrils should line up with the corner of the eyes and be no further than that.